Hi, my name is Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today is Friday, February 12th, and this is our COVID briefing. First, I just want to say I'm sorry I missed you yesterday. I ended up in back-to-back meetings all day and just could not find time to get this recorded. I do try to record these briefings on Tuesdays and Thursdays, but occasionally other things come up and I end up having to do it on a different day. So sorry for that. So let's get to the numbers. We have now had 7,946 cumulative positive cases of COVID-19 in Missoula County to date, with 13 new cases since yesterday. We've had 82 deaths associated with COVID-19. We currently have 164 active COVID-19 cases. Those active cases and their identified close contacts do remain in isolation and quarantine and are being supported as needed. Our current average incidence per 100,000 people is now at 17, which is great. So just remember that all of these numbers, as well as the graphs and figures associated, are on our website at missoulainfo.com. The state of Montana is reporting 97,063 cumulative COVID cases, which is up 221 new cases since yesterday. There are now 2,917 active cases with 100 active hospitalizations across the state. There have been 1,324 deaths related to COVID-19 statewide. The University of Montana has had 627 cumulative positive UM-associated cases since the beginning of fall semester back in August, with no new cases reported in the last couple of days. There are currently 10 active UM-associated cases. Missoula County has now administered 16,133 doses of COVID vaccine, with 4,419 people having received both doses of the vaccine so far. I have lots of updates today, so bear with me as this is going to be a little bit longer of a briefing. Today I'm going to be talking about the proposed changes to the restrictions for the Board of Health meeting next week, Missoula County's mask mandate, updates to the quarantine and isolation guidelines for people who have been fully vaccinated, and our vaccine clinic over at Lucky's. First, I just want to say thank you to all of you out there in Missoula County for working so hard to help get our numbers down by following the local health regulations. When the restrictions were put in place last fall, we were seeing a huge spike in cases. We've now seen a steady decline in our cases, and our incidence rate is now below the goal of 25 cases per 100,000 people and has remained below that goal for 2 weeks. This tells us that our local strategies are working. So our Board of Health will be meeting next week to revise the current restrictions that are in place here in Missoula County. Some of those revisions will include increasing group sizes for events to 50 when indoors and 100 when outdoors, removing capacity limits except as necessary to meet social distancing requirements, and removing certain restrictions on fitness facilities, pools, and places of worship and assembly. Bars will be able to allow customers to order at the bar as long as there's a designated spot for that, and pool and darts would be allowed as long as social distancing can be maintained. Self-service buffets will be allowed as long as social distancing can be maintained and food is served in a way that reduces contamination from common utensils. And lastly, we're going to be revising the language throughout the rule based on the input from community entities for clarity. If you would like to provide feedback ahead of the Board of Health meeting, please go to our website at missoulainfo.com and you can submit feedback through our feedback portal there. Although Governor Gianforte is repealing the statewide mask mandate, during that same announcement, he did voice support for local authorities and their decisions to enact local mask mandates. One of the restrictions that will remain in place is the mask mandate. Missoula County residents age 5 and over will need to wear a mask, continue to wear a mask when in public spaces. The majority of other large health jurisdictions in Montana are also retaining their mask mandates. Scientific evidence shows that when used with other COVID mitigation strategies, such as social distancing, masks reduce the transmission of COVID-19. In fact, the CDC published a study in November where they looked at mask mandates in Kansas. In Kansas, there was an optional mask mandate, and counties could decide if they wanted to opt in or not. In the counties that did adopt that mask mandate, they saw cases of COVID decline. And in the counties that did not adopt the mask mandate, they saw cases of COVID increase significantly. Additionally, a recent study that was published in the Journal of American Medical Association last month found that up to 59% of COVID transmission actually occurs when an individual is not experiencing symptoms, whether they're in the pre-symptomatic phase or in people who never develop symptoms at all. While we have seen our numbers of cases dropping and we're actively vaccinating people in our community, we do still have quite a few vulnerable people in our community that have not yet received the vaccine. So we do need to continue to mitigate that COVID transmission in our community by doing what we can, which means continuing to wear masks, practice social distancing, frequent hand washing, and getting tested if you develop symptoms. Next, I want to let you know that the CDC did come out with some new guidance on quarantine and isolation for people who have been fully vaccinated. This new guidance will be implemented here in Missoula County. Vaccinated persons with an exposure to someone with suspected or confirmed COVID-19 are not going to be required to quarantine if they meet the following criteria. Number one, it must be 2 weeks or more after receiving the second dose of vaccine in a 2-dose vaccine series, or 2 weeks or more following the receipt of 1 dose of vaccine in a single-dose vaccine. It must, item number 2, it must be within 3 months following the receipt of the last dose in the series. And number 3, you must have remained asymptomatic since the current COVID exposure. If you don't meet all 3 of those things, you should continue to follow the current quarantine guidance after being exposed to COVID. Fully vaccinated people who do not quarantine should still watch for symptoms of COVID-19 for 14 days following an exposure. And then if you experience symptoms, you should still get tested for COVID. An exception to that guidance is that vaccinated people who are hospitalized and residents in healthcare settings should continue to quarantine following an exposure. This exception is due to the unknown vaccine effectiveness in this population, the higher risk of severe disease and death, and challenges with social distancing in healthcare settings. Last, I want to talk about vaccine. We are still in phase 1B of the vaccine rollout plan here in Missoula County. And there are approximately 40,000 people in the county who qualify for vaccination under this phase. So we're taking a tiered approach to vaccinating in this phase. We're currently only vaccinating Native Americans, people of color, and those 70 and older. And we're only receiving about 1,500 doses per week into the county. We continue to have clinics at the Old Lucky's Market Space and Southgate Mall as we receive vaccine. Right now, we rely pretty heavily on our partners to allocate vaccine that they receive for our clinic. And hopefully, as more vaccine becomes available, we'll start getting our own vaccine directly from the state. Currently, we're able to get the doses of vaccine into people within 24 hours of us receiving the vaccine. So we do have a very efficient process to get that vaccine out to you. We were able to test a new online platform for vaccine scheduling this week, and we've worked out the kinks, so we hope to continue using that platform for scheduling the majority of our appointments moving forward. We will also be setting aside a certain number of appointments to be scheduled by phone using the 258 info number for folks who don't have internet access or have trouble using a computer. If you do call 258 info, you will need to select option number 3 for vaccine scheduling. Again, I want to remind you that each organization will have their own way of scheduling. So the process that I talk about here is really just specific to our clinic at the Old Lucky's Market at Southgate Mall. Our clinics this week continue to book up really fast, and we understand that that's really frustrating, but it's likely going to be that situation until we can get more vaccine into our county. So please check covid19.missoula.co for more information about various vaccination clinics that are occurring. That website is updated as new information becomes available. So that's it for today. I hope you're all staying healthy and warm out there with these frigid cold temperatures. As always, you can subscribe to me on YouTube under my name, Cindy Farr. That's CindyFarr. You can click that notification bell so you get notified when additional videos are uploaded. You can follow us on Facebook at the Missoula City County Health Department's Facebook page. You can call 258-INFO if you'd like to schedule a test for COVID-19 if you're having any symptoms, if you have any questions about COVID-19. And when clinic scheduling is available, you can call that 258-INFO and select option number 3 for assistance with vaccine scheduling if you have a difficult time using a computer or you don't have internet access. Again, check out our website at missoulainfo.com and go to covid19.missoula.co for more information about the various vaccination clinics that are occurring throughout the county. Until next week, everybody, stay healthy.